Drug use among our youth is always a cause for concern. In seeking to find ways to combat this scourge, the National Council on Substance Abuse conducted a study among students to guide the process forward. The findings of the Barbados National Primary School Survey 2020, Drug Use and Related Issues Among the Primary School Population, were presented on Monday, October 5, 2020, at the National Council on Substance Abuse headquarters at Belleville. The Barbados Government Information Service presents an edited version of that presentation.
The first of 9 listed functions in the NCSA Act is for the Council to, and I quote, advise the Minister on measures for the eradication or control of substance abuse, end of quote. The NCSA is in its 26th year of doing this, along with the work related to that. The fourth listed function in the Act is to, and I quote again, authorize, conduct and facilitate research or surveys on substance abuse. Following its appointment, end of quote. Following its appointment in August 2018, the NCSA's Board of Directors insisted upon this fourth function being prioritised. We requested more accurate, up-to-date and evidence-based information on substance abuse and any developing trends in Barbados. Establishing what was happening with our youth, not only in schools, but also in our communities and the workplace, is important. Only then can NCSA encourage appropriate substance abuse policy initiatives to be developed by government for the benefit of all Barbadians. NCSA has fulfilled these 2 vital functions. In July 2020, some of you joined us in this format when we presented findings from our 2017 and 2018 Barbados Drug Information Network BARDIN reports. Today we go one step further by releasing the findings from our National Primary School Survey 2020. Our manager, Mrs. Hunt, will later offer on the NCSA's behalf sincere thanks to individuals and organisations without whose assistance and cooperation in conceptualising, leading, collecting and analysing the material gathered, the findings of this survey would not have been possible. But there is more to come. The NCSA has initiated preparations to undertake a national secondary school survey in Barbados. That research will hopefully be conducted in early 2021, and so by next summer, the findings will be known, at which time we might meet on another occasion such as this. As I've previously stated, successfully tackling the drug-related challenges in Barbados remain a multi-sectoral challenge. Through research, we can enhance our understanding of the substance abuse problem we are dealing with. Therefore, we must continue to be willing to share information, deepen our linkages, and further strengthen interagency collaboration. Such cooperation is important to any future success we hope to achieve in the fight against substance abuse. I believe that if we can sustain a collaborative approach on fighting drug use and its misuse, not only in Barbados but across the Caribbean and further afield, then the capacity to produce additional current surveys based on evidence-based information gained from research will certainly benefit our societies going forward.
Delivering the feature address was Minister of Home Affairs, Information and Public Affairs, Wilfred Abrams.
The national response to the local drug problem requires reliable and up-to-date information. Therefore, surveys such as the one you're about to hear are important tools for policy making and programming, as they provide an understanding of the drug situation, thereby enabling us to craft the most appropriate responses for specific populations. Ensuring the appropriateness of our responses is especially important for the youth, as research has shown that drug use during adolescence is associated with a number of negative outcomes, including low educational attainment, involvement in crime and substance abuse disorders, and these carry on into adulthood. In fact, The Centers for Disease Control have stated that the majority of adults meeting the criteria for substance abuse disorder began using substances during their teen and early adult years. Adolescent substance abuse is also associated with risky sexual behaviors, including early sexual initiation, having multiple partners, and not using condoms, all of which put our youth at risk for HIV, sexually transmitted diseases, and early pregnancies. Such negative outcomes can have a lifelong impact. It is therefore incumbent upon us to take every step to prevent the early onset of drug use. And findings such as those about to be presented today can inform an evidence-based approach, which of course is the gold standard. I understand that this National Primary School Survey is a third of its kind to be conducted in Barbados, and was informed that NCSA has adapted and modified its data collection instruments for each of the survey rounds so far. This approach ensures the relevance of the surveys and has enabled the Council to address critical issues at each point in time. I am particularly intrigued by the inclusion of newer drugs during this round, such as lean, or for those in Barbados, we call it purple drink, and e-cigarettes, as well as the inclusion of social determinants of drug use. The latter is particularly important as the National Institute on Drug Use, the NIDA, which is the lead federal agency supporting scientific research on drug use and its consequences in the United States of America, has recommended the inclusion of risk and protective factors in drug prevention programs. They consider these to be essential targets for effective interventions within the family, school, and community settings. While preparing for today's event, I discovered that school surveys across the world do not usually focus on students at this young an age. Rather, they typically target secondary or high school students. Therefore, the NCSA is somewhat of a pioneer in this regard. In fact, I understand that in 2012, Bermuda used the Barbados model to conduct the only other primary school survey in the region. As such, I wish to congratulate the Council for being a leader in this area, and to urge you to lend your expertise to other regional and international partners who may be interested in conducting similar surveys. Before I close, I must say that the 2020 survey could not have come at a better time. As you know, the Governor General, Dame Sandra Mason, in her recent throne speech, announced government's intention to decriminalize the possession of small amounts of marijuana. This move will also see special repercussions for minors caught with the substance in their possession. It will be important for us to assess the impact of this legislative change on the patterns of marijuana use and related issues within our society. To do so, we will need baseline measurements for comparison, and the findings of this survey can serve as a necessary yardstick for the primary school population. Similarly, I encourage the NCSA to work with various stakeholders, such as those in the health treatment and supply control sectors, to identify and gather other data which can be used for evaluation purposes. On a personal note, I have a particular interest in children. I believe that we owe it to our young people coming up to help them to grow in the best Barbados possible. Circumstances have developed, but at the end of the day, we have a responsibility to those who are not in a position to make informed choices or decide for themselves as to what is in their best interest. Children have a say, but we as adults need not reinvent the wheel. We've all passed through the stage of primary school. We know the challenges faced by children who are trying to come into themselves, who are getting to know themselves, who are about to transition into a different environment and step up to a secondary or high school level. We know the pressures that they're going to face as children. We know the dangers of peer pressure. We also know, because of our association with this council or similar organizations, the dangers of illegal or harmful substances on their young brains. Children are naturally curious. That is the nature of being a child. Children want to investigate what they don't know. Children want to be cool. We have a duty. It is incumbent upon us to share with them the dangers that we know and to explore the dangers that we don't fully appreciate, so that we can guide them when the information becomes known. Scientific and empirical studies such as the one about to be presented today form the baseline. They inform us so that we as governments, or we as NGOs, or we as institutions can formulate the correct policies and target our resources in a meaningful way based on information and not anecdotal evidence. I am very proud, having read the survey, to be associated with this survey. This is pioneering work. We need to stop underestimating our children. They are way more intelligent than we give them credit for. With intelligence and development comes curiosity. It is not something we should attempt to stymie in children. We should not attempt to stop them from being curious. We should not attempt to stop them from asking questions. We should not attempt to stop them from investigating ourselves. Rather, we must recognize their early development now and speak to them in a language that they can understand, so that they know when choices are presented to them what is right and what is wrong, so that they have the confidence and the strength to say no when no is the only appropriate answer. But the findings, quite frankly, are alarming. And the findings suggest and support that this study was absolutely necessary, and it was absolutely necessary at this point in time. In fact, to be honest, I think we would have suffered if we had left this study any later. This study will certainly inform government's policy in relation to the focus of substance abuse and counseling and education with respect to children, and it has proven something that I have long since held: we underestimate our children.
Coming up next, a look at the findings with coordinator of the survey, research assistant at the National Council on Substance Abuse, Laura Foster.
Our 2020 survey was the third of its kind to be conducted here in Barbados. The previous surveys would have been done back in 2006 and 2009. But like its predecessors, the current survey was primarily a prevalence survey. So that means that we were mainly concerned with the levels of drug use among our target population, which in this case was the Class 3 and Class 4 students who are enrolled at the primary school level here in Barbados. While it was mainly a prevalence survey, we did, however, also examine some other factors such as common sources and locations of use, as well as age of first use, and a number of factors associated with drug use. Now, in this round, we expanded the scope of the survey somewhat, and we opted to include new variables such as parental involvement, school experience, social media use, video gaming, and bullying. And as the Minister would have stated, we also added a number of new drugs which have either emerged or become more popular since our last survey. And these include energy drinks, e-cigarettes or vaping, and lean, which, as he said quite correctly, is also known as purple drink. And for those of you who are not familiar, lean is actually a mixture of codeine cough syrup with a soft drink, quite often Sprite, and hard candy, quite often Jolly Rancher. And this mixture was actually popularized by the rap industry. Now, for our survey, we had a representative sample of 1,958 students take part. And these students were drawn from 50 schools across Barbados. 46 of these were public and 4 were private. We collected our data between the months of January and February 2020. So this means that we were able to get in and out of the field before COVID set in. And we were also very lucky that we were able to complete our data entry process before our lockdowns came. So we basically had no interruptions in this survey where COVID was concerned. To collect our data, we used a self-administered questionnaire, which consisted of 47 closed-ended items. And we had a team of trained field officers who were responsible for administering the questionnaire to the students. And what they did was go out and read the questions aloud to the students as a class, or a so-called group, within the classroom setting of the participating schools. And students were then asked to mark their selected responses on the questionnaires which were provided. Now, turning to our data analysis approach. For this survey, we opted to do something somewhat different, and we opted to go with weighted data, which we hadn't done in the previous surveys. So for those of you who are not too statistically au fait, what this basically means is that we made some statistical adjustments to our database so that we were able to correct for any groups which may have been over or underrepresented. And this then will help to make the results more reflective of the wider target population by reducing bias. Moving on now to past months drug use, again a very similar picture to what you would have seen for lifetime and past year use. So alcohol, energy drinks and inhalants remain the top 3 substances in this time frame as well. So how do our statistics match up? Well, when we do some comparisons with the 2006 and 2009 data, we can see movements here in the data. But I want to caution you about drawing inferences from this comparison. Because remember, we would have introduced weighted data in this round. So that makes the data slightly different to that from the previous rounds. So while yes, we are comparing apples to apples in a sense, because we have asked the question in the same way across all of the rounds, we are almost comparing green apples to red apples, as there is a slight difference. Nevertheless, as I said, we can observe movements in the data. And what we can see here is that overall the prevalence rates have either declined or pretty much held constant between 2009 and 2020. The only substance which has shown an increase is Fanta. But unfortunately, we do not have any 2006 data for this drug to be able to observe it across all 3 rounds. What is also particularly eye-catching here is the sharp increase in inhalant use between 2006 and 2009, and then the sharp decrease between 2009 and 2020. This may have something to do with how we ask the question and the examples given, because we have always had concerns as to whether or not students are accurately interpreting the term inhalants and that they are not in fact confusing it with inhalers. So we went to particular lengths this time to make sure that we were clear in the examples which we gave. And I must point out that this is not a concern which is peculiar to Barbados, as I have heard our counterparts across the region express a similar concern with respect to their secondary school surveys. Nevertheless, this is something we're going to have to watch as we move forward. We turn now to age of first use. And this slide shows that overall the age of first use was generally between 7 and 8 years for the various substances. Now in isolation, this would be suggestive of early onset, which is concerning. But we have to remember that we cannot look at it in isolation because of the young age of our participants. So we would naturally expect these participants to have a younger age of first use than what we would find in a secondary school survey or even a general population survey, where our target population ranges in age from 16 to 65. Now when we look at the most common sources, I have provided here for you the top 3 most common for each of the substances. And what we found was that friends and family were generally the most common sources for all of the substances. In terms of tobacco and Fanta, it was friends. For alcohol, energy drinks, and marijuana, it was the family. In terms of inhalants, you can see that it was the home, very closely followed by the family. Now, in our full report, you will see that we actually broke the family category down into parents, siblings, and other relatives. And when we did this, what we found was that parents were actually the most common family source for drugs such as marijuana, alcohol, energy drinks, and inhalants, while other relatives were the main source in terms of the family for tobacco, cigarettes, and Fanta. In terms of locations of use across the board, we found that it was the home for all substances. That was the top location. And this stands to reason, given the fact that that family was one of the most common sources for drugs, and also the young age of our participants, as they are quite likely spending much of their out of time school at home or in its close environments. So now you have the base for us to go from here. I have presented again the prevalence rates, the age of first use, the sources and locations of use. So let's move into some factors which are commonly associated with drug use within the literature, and we call these risk and protective factors. But what exactly are risk and protective factors? Well, risk factors are those which are known to increase the likelihood that a person will engage in drug use, delinquency, school dropout, teen pregnancy, violent behavior, etc. And these can simply be related even to the characteristics, of the students themselves, their families, their friends, their school, their community. Protective factors, on the other hand, are the opposite, and they serve as a sort of buffer to reduce the likelihood that they would engage in such problem behaviors. Now, we looked at quite a few risk and protective factors in this survey, and I'm going to start with the demographic variables. When we looked at drug use when we looked at drug use and gender together, we found that there were significant differences between boys and girls with respect to the lifetime use of cigarettes, marijuana, energy drinks, and Fanta. And in each case, the lifetime prevalence was higher among males. So what this is telling us is that there is an association between drug use and gender with regards to these four substances. We did not find any such differences with respect to alcohol or inhalants, so therefore there was no such relationship with these two. Similarly, for grade level, we also found significant differences between Class 3 and Class 4 students with respect to the consumption of alcohol and marijuana, whereby the lifetime use of alcohol was higher among Class 4 students and the lifetime use of marijuana was higher among Class 3 students. So this is indicative of a relationship between grade level and the use of these two substances. We did not find any association when it came to tobacco, cigarettes, inhalants, energy drinks, or Fanta. Turning now to perception of harm. This slide shows us that overall students generally are aware that there are risks associated with drug use and that they consider smoking cigarettes, using marijuana, and drinking alcohol to be the top three most harmful. When we compare the 2009 perception of harm statistics to those from 2020, we can observe that there has been a slight increase in the percentage of students considering smoking tobacco cigarettes to be harmful, while there has been a decrease in the percentage of students considering drinking alcohol, using inhalants, and using marijuana to be harmful. But again, we have to be careful in our interpretation due to our new use of weighted data. Now, when we looked at the perception of harm with drug use, we found that there was a significant relationship between the two, whereby drug use was more likely among students who considered there to be no harm associated with the use of substances. We also asked students how easily they thought it would be to access various substances, and we gave them a number of options. And these options included easy, difficult, impossible, and we also included the I do not know what X or Y substance is option. And here you can see that inhalants, alcohol, and tobacco cigarettes were considered to be the top three most easily accessible substances by these students. I again want to put the spotlight on lean. Not only is the percentage of students considering this substance to be easy to access low, but what you don't see here, which you will see in the report, is that the vast majority actually indicated that they did not know what lean was. That was just about 85%. Now, we did some trend analysis where this was concerned, and we were only able to do trend analysis for marijuana and alcohol between 2009 and 2020. Looking specifically at marijuana, we can see that the percentage of students considering marijuana to be difficult or impossible to access has actually declined since 2009, but so has the percentage of students considering it to be easy to access. Where we have seen the sharp change, however, is with persons in the don't know category, and that has increased by about 25 percentage points. For alcohol, the students considering this substance to be easy or difficult to access has declined, while those considering it impossible or who didn't know has increased. When we looked at drug use and ease of access together, we again found a relationship. And in this case, persons who considered these substances to be easy to access were more likely to report lifetime use. So in the case of marijuana, inhalants, and tobacco cigarettes, persons were 2 times more likely to report their lifetime use if they considered them to be easily accessible. For alcohol, they were 3 times more likely to report lifetime use. We also asked students if they had ever been curious about using drugs. And we found that 18.7% had been curious. So that's just about 1 in every 5 students. And when we examined drug use alongside curiosity, we found that there was a relationship whereby persons who reported having ever been curious were actually more likely to also report lifetime use, just about 1.5 times more likely than those who had never been curious. Now, what are our recommendations for the way forward? Well, we have come up with a number of possible suggestions, which we have broken down into short, medium, and long term. I'm going to start with the short term, and here we are recommending that drug prevention education be ramped up across the primary school levels, and we want to ensure that students are exposed to the drug prevention education module within the HFLE curriculum, so that's health and family life. And we also want the drug prevention education to include those newer drugs like energy drinks, Fanta, e-cigarettes, and lean. And of course, we want to factor in the social determinants, so those things that, such as the gender, the grade level, bullying, etc., those risk and protective factors which we would have looked at. In the medium term, we are suggesting that parents be educated about the drugs used by young persons, as well as the associated dangers, signs, and symptoms of drug use, and their role in drug prevention. And of course, we are recommending that school-based efforts be buttressed with community interventions, because we are aware of the fact that children are only in school for a set number of hours each day, and they go home to their communities. So we do not want what we are doing in the day at school to be counteracted when they go home. For the long term, we are recommending that efforts be made to further restrict children's access to drugs, and we recognize that this will involve policy and legislative changes. And our ultimate goal is to have a national approach to the delivery of drug prevention education, which is coordinated by the NCSA. And we are recommending that this approach be guided by a national policy, and that there should be a trained core of facilitators who can be identified from among various groupings such as teachers, parents, NGO staff, just to name a few. And we want these facilitators to use a standardized curriculum which is specially designed for our use here in Barbados. And of course, we need to make sure that what we are doing is effective, that it is working. And the only way to do this is through continuous monitoring and evaluation. So, I know that I have given you a lot to digest here today. So what I'm going to do is to pull out the key takeaways for you before I close. So again, I'm going to reiterate that at this stage, drug use at the primary school level remains minimal and is primarily experimental. Prevalence rates have generally decreased since 2009. However, efforts should be made to increase drug prevention education for primary school students. And we want to see energy drinks, Fanta, lean, vaping, and social determinants of drug use incorporated into our prevention efforts at this level. We also want consideration to be given to a coordinated and structured approach to drug prevention education, which involves the NCSA, teachers, parents, and other stakeholders. And we want this approach to be buttressed with initiatives which target the parents and the wider community. And lastly, we want to see children's access to drugs further restricted.